Hi, my name is Anthony Barrett. I'm a facial plastic surgeon in Miami, Florida, and I'm here with a patient today who overplucked her eyebrows and is here today for eyebrow transplantation. As I explained to the patient, the hair will be removing from the back of the scalp and transplanting it to the eyebrows. Now the patient understands that the hairs will grow like scalp hair grows, so she needs to trim them and manicure them probably every few days as they grow. However, what I'll have the patient do the morning of the procedure is she'll draw in her eyebrows, as well as she brought in photos of her desired eyebrow shape and density, and we'll use that as a gauge to start to design her eyebrows. Now she'll start by drawing in her eyebrows herself in front of a mirror using an eyeliner, and then I will make adjustments according to what I see, as try and create as much symmetry as possible between the two eyebrows. At that point, then once we've designed the eyebrows, she'll be brought into our procedure room where the hairs will be taken from the back of the scalp and transplanted to the front of the scalp. Overall, the procedure itself takes about 4 hours today. We're here again with our patient who's having an eyebrow transplant today. As you can see here, what I've had the patient do since I last was with her is spend some time drawing in the desired eyebrow shape. She brought in some model pictures of eyebrows that were her goal eyebrows, and then used her own eyeliner to draw in a rough shape as far as the design that she wanted. Obviously her eyebrows are different because we all have natural differences in our eyebrows and asymmetries as far as even the height of our eyes, but these were taken into account for with the design of the eyebrows. So we'll bring her now into the OR room and start the procedure. Thank you. We're going to be performing the eyebrow transplant now. The area has been prepped and draped sterilely. She has had the strip already harvested from the back of the scalp and is now being cut into smaller 1 and 2 hair size grafts. Now the key to the aesthetics of an eyebrow transplantation are to keep the natural direction of the growth of eyebrow hairs and the proper angulation so that the grafts don't stick out, because if not planted or the incisions are not made properly, the grafts can look unnatural and stick further out. So the first part of the procedure, since we have our markings, we'll be taking care to do the periphery or the border of the eyebrows first, and then filling in the rest. Of all the hair transplant procedures I perform, I really love eyebrow transplantation because it's one of the more meticulous and artistic procedures that I perform. So we're finishing today with our eyebrow transplantation procedure, and I just wanted to show at the end of the procedure the design of the eyebrows. She's obviously very swollen at this point with some bruising already settling in, but just to demonstrate the direction of the way the eyebrows are placed in a herringbone type fashion. The bottom ones are angled in and the upper ones are angled down, as well as the middle ones crisscrossing to create a more natural appearance. Also importantly, the grafts lie flat, so in fact these are her own native hairs, which are actually sticking out and protruding more than the grafts themselves.